Seemingly, the main topic of discussion right now is how to fix healthcare and make it more affordable and accessible to the general public. Part of that discussion is about the ACA tax credits. And now a new proposal is coming forward from Senator Bill Cassidy for a different option using prepaid health savings accounts instead of the credits. Mark Pauly is Professor Emeritus of Healthcare Management here at the Wharton School, and he joins me to discuss this topic. Mark, great to catch up with you again. How are you, sir?
I'm fine, Dan. Thanks.
Thank you. Obviously, this is a huge topic, and realistically, healthcare has been a topic for quite a while. Uh, but with what we see going on right now, and I'll get into Senator Cassidy's proposal in a second, are you confident that maybe we're starting to think like we need to tackle the issue of what's going on with healthcare?
Well, tackle, I guess. Fix is a bit more of a reach. It's easy to try because healthcare is intrinsically expensive. It's hard to produce a solution that satisfies all the stakeholders.
What were your thoughts on Senator Cassidy's idea?
Well, he's trying to repurpose an old Republican idea of health savings account, and the intuition in favor of it is, we're going to create this account with dollars in it, but it's funny money, so the dollars can only be spent on health care, so that they like. But the idea is that provides you with an incentive then to economize on your use of healthcare yourself, or economize on the health insurance premium plan you choose, because if you use money from your account for one thing, you don't have it left for another thing. So it provides not a high power incentive, but at least an incentive for individuals to be more economical in their use of healthcare services. So that's the logic of it. Of course, the details matter, and particularly what matters is how much money and to whom. Which is really what is much more important to a person than this rather limited incentive.
Well, and I think one of the questions, in regards to counteracting that idea, is if you're providing these HSA accounts, these people still need to be able to get insurance, and the question is, would they be able to get insurance in the first place?
Yeah, the political backstory here is insurers are ripping off the public, and of course, you never can go broke by attacking insurers. Instead of doing what the Obamacare does, which is when you choose your plan, your subsidy, if you're eligible for subsidy, and most people are, goes straight to the insurer. Instead, the subsidy comes to you. But your comment is quite right. If you then turn around and say, well, I'm going to need insurance, and most people would say that because they don't want to be exposed to the risk of financial disaster if they got really sick, you're going to pay money to the insurance companies anyway. So they'll get you coming and they'll get you going. One way or another, the only advice you would offer to a person is, well, be careful what insurance you buy and try to find one that doesn't charge you excessive amounts for what you're expected to get.
So is there a direct link to what's being discussed right now of what we've seen play out with the Affordable Care Act and the higher costs and the higher prices of healthcare in general over the last few years?
Well, there's a political link, which is that we are seeing in 24 and 25 an upward blip in health insurance premiums. My diagnosis is it's a delayed response to the end of COVID, but nobody knows for sure the reason. And that's made people look for a solution. Obviously, the solution in the Biden plan, which just was what the Democrats were holding out for, but they didn't get, was to provide more money to pay for the extra cost. Republicans don't want to do that. They want to economize. And so the idea is to convert at least some fraction of what would have been the Biden subsidies to health insurance plans to payments directly to individuals for these accounts. But as I said, we would expect that the great majority of people would then turn around and use most of that money for health insurance anyway. So the insurers aren't going to be crying crocodile tears over this development.
I know you and I have talked for many years about healthcare in general. Let me put you in the big chair for a couple of moments and think about what moves can be made as we move forward here to improve healthcare in general? Because seemingly that's going to be the biggest talking point for, it feels like, quite a while into the future.
Yeah. Yeah. Well, from an economic point of view, I'm a card carrying member of Health Economists Associated, and we always pick on the subsidy to employer provided health insurance. So when I was still working at Wharton, I figured about $15,000 a year was what Penn paid toward my health insurance, and I didn't have to pay taxes on that. So, and that probably did make me choose the most generous plan, because after all, Penn was paying for it. Although we economists think sooner or later you're paying for it yourself out of your wages, but at least you get this tax break. The Treasury was helping me as a upper middle income Wharton tenured professor to afford health insurance. And of course, it's a crazy subsidy because for my assistant or for a lower income person, the subsidy isn't nearly as great because they don't have as high a marginal tax rate. So that's what we would think of as, but that doesn't have political appeal. The other of rearranging the healthcare system. Well, a lot of people have tried, and so far, they've come up with nothing. But they keep trying to change the way they pay providers of healthcare to try to get them to either offer lower prices and or recommend the most, I would say, cost-effective services as opposed to services that are of relatively low value. But so far, nobody's come up with a magic formula for that.
And
Um,
it feels like that we're going to continue to kind of ride down that road for the foreseeable future.
yeah, I mean, it's the sky is not falling. The fraction of GDP going into healthcare in 2023 was essentially the same as what it was in 2009. Healthcare spending wasn't running ahead of people's ability to pay for it, although because income is unevenly distributed, the people who didn't get that bump in GDP translated into their income were the ones who are complaining about it's getting less and less affordable.
Right. Mark, great to talk to you on this. Thank you, and have a great day. Thank you, sir.
All right, you too. Thanks. Bye.
Thank you. Mark Pauly, Professor Emeritus in Healthcare Management here at the Wharton School.